He just asked me today. It's like, well, I remember this feeling. I'm like, you were the first one in person.
Yeah, that's great. Okay, so we have several on Zoom. Welcome, friends. Doc's gonna start
Uh,
officially. We were just telling
Once I
stories,
get
but
the countdown and the finger thumb up, all right.
we have Kevin in the back.
Yeah.
Okay, go ahead.
Okay. Welcome. I am Neurochiro Doc Brock. You're at the Rehab Wellness. Let me see that. Let me read it because I'm not saying it right.
Well, that's wrong.
Neuropractic Rehab and Wellness. As I'm looking at our sign through the window. So, Neuropractic Rehab and Wellness, I practice functional neurology. And I think it's a topic that is just not discussed. A lot of people don't hear about it. No one talks about the function of the brain and how it actually fires to control body systems in real time and how we can rehab it, firing reflexes back in brain through sounds and body movements. Today's edition, we're looking at vertigo versus disequilibrium versus not nausea, but dizziness. So actually, I wanted to rewrite that. Nausea comes out of dizziness, right? So when you stand up really fast and you're lightheaded and you feel nauseous, sometimes with vomiting, that's what we're looking at for dizziness. So you can be dizzy, but not be disequilibrium or imbalanced, or maybe not have vertigo. You can have all of them, but if you're just dizzy and your spatial awareness orientation isn't changing, then you're just dizzy. You're not imbalanced or have vertigo. I'm going to put dizzy or dizziness. But when I went to look up on PubMed for vertigo, it says there was over 200 types or conditions that create vertigo. There's so many. But then I also looked on some other sites and it said, well, vertigo, we don't really know the cause of it. It's primarily idiopathic, which means they don't understand what causes. So you see a lot of conditions, you look on PubMed, you get into that search, idiopathic causation, idiopathic, unknown cause. Nobody ever knows what causes these things. You're looking under the AMA result for everything, they just don't know. And they say that. They made up a fancy word called idiopathic, which just means they don't know why something is causing. If it's iatrogenic, that means doctor causing. So if you had a surgery and they severed an artery, that's iatrogenic, doctor causing problems. So most of the ones we see, vertigo, disequilibrium, nausea, these are these are idiopathic. So they don't know what it is or what caused it anyway. So over 200 conditions, all relating to ending up in vertiginous, vertigo-like things. But I'm going to break it down though because it's very confusing. But let's see. There any questions so far?
No, it's just
Yeah, because we'll talk. This is the subject. We'll go about 20 minutes going through that, and then the rest of the hour, the other 40 minutes or so, is just all questions and answers. Anything. It could go to any topic that it kind of leads us down to. But
just say hi to all your people on Zoom.
go ahead.
Are you? Oh, well, hi,
Oh,
James.
I can't
I
see their
already
names.
said hi,
Yeah,
but welcome. Yeah, I don't know who
yeah.
everybody is because you guys have weird names on here,
But this is Neuro Cairo Crystal.
but
No, she runs the office. She and everything here. She's the glue and the umbrella and everything else. Otherwise, I'm just some guy in some room doing weird stuff. So
we shouldn't blame it. That's weird stuff.
oh, I thought the
It is a
umbrella.
little weird.
That's strange because we never see it. We never learned what it does, and the functional brain isn't what we're ever taught. So the 20 years I've been practicing, I just wanted to describe it and give the knowledge back. It's on the prevention side. So this I'm not medicating, I'm not doing surgery. Actually, when you kick in brain instability and body works, then you avoid that later on. And you save medicine primarily for emergency medicine, just saving your life stuff. And all this prevention could be done before that, keeps you away from the other side. Basically, but our spatial orientation comes in through our eyes, our ears, and our feet. So when we're looking at vertigo, we're looking at the crystals. So they're otolithic crystals, and they're created in the vestibular canal in the inner ear. So these crystals are, I'll draw some. So that's an ear, and this is the canal. and you have a tympanic membrane or eardrum. But inside of that, you have two systems. You have one for hearing and you have one for balance. Those are the vestibular canals. So cochlea kind of looks like a swirling thing that receives hearing. The three bones will vibrate and send that sensation to our brain to tell us that there's some kind of sound. But inside of that, a little deeper, we have this vestibular canals. And when you're looking at the canals, there's this posterior canal, an anterior canal, and a horizontal canal. So there's three canals depending on where we put our head. Posterior canals left and right, horizontal canals left and right, and anterior canals left and right. So six canals. And inside the canal are these hairs. So in the hairs, is that picking up well enough?
Yeah.
In the hairs, so we really have hairs sticking inside fluid.
Hair sticking inside
Yep.
fluid.
Yep. So inside the canals are fluid. And fluid rushes back and forth. So if I turn my head, the movement of the fluid will bend the hairs. And when they bend, they send a signal to brain to tell me that, oh, I'm turning. So it gives us this sense of motion. The fluid moves by, the hairs bend, like sticking your hand outside a window when you're driving and it flies back like that. That signal tells the brain that you're moving forward. But in our head, it has the three canals. So it tells us we're spinning left, we're spinning right, we're spinning backwards, or we're spinning forward, or a combination of all those. But the problem with vertigo, which really classifies it, is that you have it's called benign positional paroxysmal vertigo, BPPV. So, but basically, vertigo. And to have true vertigo, you have to have vertiginous or vertigo like spins. Most common symptoms at night, you're laying there, you turn to the side, and all of a sudden the room just starts rocking in circles. That's what happened. The fluid turns crystallized. So it hardens, and you get these otolithic or ear loving crystals or rocks. So you have otolithic crystals. So in the fluid, it's making these little rocks. And the problem is, fluid will dissipate or move past, the rocks float to the top. So in this angle, we'll have this rock floating constantly by, tickling all the hairs. Where if it wasn't there, the fluid moves past, we don't get the sensation unless we're truly spinning. The rock, though, hangs out and keeps tickling the hairs, telling us we're at the same sensation of full spin. So when you have true vertigo, that's the crystals in the ear thing. And it's a
Crystals cause the dissonance.
Yep. The crystals bending the hairs, telling our brain we're actually turning when we're not, causes our dizziness or the vertiginous spins. Because you can be imbalanced and you can be dizzy, but if the crystals are in there, you're spinning. That's different than the other two. And you can have all of them. But if the only way to really measure true vertigo is on a Hull-Pikes drop test, where you sit on a table and you put your head back into one of those canals and drop them fast. And you're upside down, and the practitioner is looking at your eyes, and they're watching for the eyes to twitch like that. That's the crystals passing the hairs, firing the eyes. That's the only true. That would be a positive Hall-Pikes drop test. So if they don't drop you, they can't tell you there's vertigo because it's undiagnosed. The only way to really diagnose it, you drop it, and you see the nystagmus eye beats. That designates the crystal in real vertigo. So when you go through it, the treatment is called an Epley's maneuver. That's Epley's. So often you go to urgent care, you're super sick, vomiting, can barely walk. You're sitting in front of a practitioner there, and they go, "Oh yeah, I think you have vertigo. Here's a sheet, and you're supposed to drop yourself back at home into these canals." That's called the Epley's maneuver. So the diagnostic test is the Hall-Pikes drop test, followed, if you have a positive and those eyes are going, followed by the Epley's maneuver. So one would do the drop, see the vertigo, and then slowly take another 5 minutes moving the head around where these crystals are. It's going to send the crystal floating to an area, the little door in there called the vestibule. Now, the vestibule is at the end of these little hair guys. They have this little tank down there. So you can move the crystals or move the head around the crystals, which will dislodge them to go into the vestibule. And inside the vestibule, there for about 12 hours, they'll start to reabsorb. That's our body's natural filter system for this. But if you don't, it's a very artistic trick or treatment because it takes many, many drops. You have to drop hundreds of times to see it, do it right, and then follow through correctly the outplacement. Usually at the urgent care, they just print off a paper and tell you to go home and do it themselves. If it was so easy, they would do it in front of you. They would do it there, but it's not. So they print it off and let you go because it takes a lot of practice to drop someone, look at the neurologic signs, and then slowly, correctly move your head around where you get those crystals to come out to the vestibule. And once you're there, the crystals are absorbing. And as long as you keep your head above 30 behind you or above 30 in front of you in that angle, so it doesn't come back out and just wreak havoc in the canals again, it'll reabsorb in the vestibule. Oftentimes, they usually do drops clinically about the first day, the third day, and usually the seventh day. So when the percentages of the crystals clearing up, some you'll get a big response to start with, and you get a lesser response. Every time you do more of a Hall-Pike's drop test, it clears up more and more of the crystals. So the case you have to have a good practitioner who's done lots of Hall-Pike's drop tests and know how to do an epilepsy maneuver proficiently. Because lots of doctors types they know about it, but until you're doing hundreds of them, you're not really that good at it. On medicine, a lot of they want if you have vertigo, they tell you, well, turn off the lights and kind of rest in a room. And you're like avoiding, which isn't more of a treatment. You're just like trying to manage it, but it's not much of a treatment on the AMA side. They have medications and they tell you to rest and stuff. Yeah, they're assuming. So if I was in medicine, I was a primary in medicine, you think first maybe it's an infection in the ear. Second, if it's clear and you look in and there's nothing and it's tested with no infection, then you go right to maybe it's a brain tumor. So we're going to do MRIs and look for tumors pushing or something going on there. So it's very extreme, like nothing to an ear infection to brain tumor or stroke or whatever it could be.
What caused the crystal?
Nobody knows. Idiopathic. I have. I think when fluids have a hardening, like arthritic procedures, or we're dehydrated. That's a good one too. Then they can take fluid and actually harden it.
There's a belief that if you remove the wax, you start hearing this. That
Oh yeah, because your ear has to be clear to receive the sound and the orientation of space around you, and that's the low hanging fruit. You do look in the ear if there's a lot of wax. You can always drop a syringe in there and push it out. I have kidney pans that I push out and syringe out, any of the earwax.
what does removing the wax has to do with the crystals and the blood? All that.
Yeah, because of the lack of firing from this sensory organ. Because our brain has to know where every organ from our outside afferents, we call them sensory afferents. Our eyes receive vision, ears have to receive balance and frequencies that convert into what sound would be. If that's blocked, then we lose it.
Saying about the crystals and the hairs and all that.
Yeah. So when
Where does the wax?
so when
Like
yeah, because this membrane has to move. It's a little bit further. I mean, it's extremely close, but this tympanic membrane vibrating like a drum has a lot to do with the health of everything.
on each side of that.
Yeah, wax would build up on the outside pinna. Yeah,
Why doesn't the wax
Help push energy.
do that?
because it doesn't move that drum of a tympanic membrane the same. So when that'll
It's like a
interfere with the yeah, it's blocked.
And a lot of times removing the wax, it stops the bleeding. What?
because of the lack of tympanic membrane flexing, which fires into moving fluid also. It has a fluid movement to it. So if you block the movement of that water in there, or the otolithic water, the hairs don't bend right. So
So,
when
so
so when
crystals are not always the reason for vertigo or
yeah,
losing.
well, you could still be imbalanced or have disequilibrium, which feels like that. So when or
But you can already got wax, right? And not crystal.
yeah, true. So a lot like the first check I do is I'll look at if their balance canals are firing right, by looking at how their eyes are moving, how their muscles are responding to where their head positions are. And if that seems dysfunctional too, we'll do treatments for the disequilibrium and imbalance and clear out the crystals. Or then maybe they don't have crystals and all they have is a weakened balance canal. So if I sleep on my right side, and that balance canal for my head to be here is under firing compared to the other five. I'm going to get dizzy every time I put my head there. Maybe not full vertiginous spins, but I'm going to be disequilibrium. I'm going to be imbalanced. I'm going to feel dizzy from just it not firing. So that balance canal in the inner ear just might not be firing fast enough, and you'll get balance or imbalance like things. Then interesting, this section, we're looking at cochlea for hearing and semicircular canals for balance. You could have diseases that like a tumor presses in or Meniere's. We often hear these too. Meniere's disease. So Meniere's disease is where you can't hear in one side and you get dizzy. Knocks out both of these. So hearing and balance. Another name for that, they call it, because that's idiopathic also. Meniere's disease, we don't know how it happens, but they call it idiopathic endolymphatic hydrops. So it's an interesting description, but they say there's swelling or extra fluid in that region, and they start to lose their hearing and be imbalanced. That's one thing when I'm looking at patients, I want to know if they have hearing in there. They're missing it. So if they lost their hearing and they're dizzy, and that leads me to other diagnoses. So when eyes, ears, and feet.
So many years ago, maybe 30 or more, I I was doing this and the doctor gave me antibiotics, but the dizziness did not go away until somebody recommended that I can get wax out, and then
Yeah.
the dizziness went away.
Yeah. So you didn't have vertigo, but you had disequilibrium or imbalance. And the ear being infected or clogged with wax, they could definitely contribute to that. There's other things in brain. If your brain doesn't recognize process sound well or depth perception. So remember, our spatial awareness is through our depth perception. So if we're walking and I have to judge a step, but if my eyes aren't working for convergence, I miss it. And that'll create symptomology of imbalance too. So you can have eyes fatiguing. If I don't know where my feet are well, feeding back to brain telling me where I am in space, you could have a dysfunction that way. So you can be imbalanced because your feet aren't firing to tell your brain where it is, or you can't see where you're going, which is another dysfunction. That that is actually in thalamus. So thalamus, so I call these sensitivities. So anytime thalamus is the most important dead center part in brain and has a huge blood supply on it. And this is the filter for every sensory in our environment. It has to process well here. And its whole job is to block out all the noise I hear and the temperature changes and balance and all this. So it attenuates or filters. So it'll take all that information and bring it down to where I can focus on what I'm doing. But if you're not processing light well, you're sensitive to light and it's not filtering well, where it's no big deal to you, it's going to cause muscular changes and headaches and stiffness, and you won't like sound. So you start wearing glasses or hide in the dark and all these things. This is a problem with thalamus. It's a functional change in the brain's filter or the shield around us. So it's not filtering your ability to know where your feet are when you're standing for balance, or your eyes to judge distance. So I'm looking and I can't judge my distance to see here or walk up the step. I miss it and I fall. That's a thalamic weakness. And that can cause imbalance too. So here we go through all the different systems in brain to make sure they're firing. Because you may not have a crystal, but you could have these and or these. You could have both. So it's brain function, knowing where all our sensories are, and having a making sure there's no crystals, and then you go through the whole different systems. But
Miss Joyce has a question. Actually, I was asking if sinuses or sinus issues, if it affects this.
oh yeah, so with the eyes processing depth perception, my ability in my thalamus to process my eyes to hold that gaze. If I can't do that, and you're congested and it's in your frontal sinuses, it inhibits your eyes to come close and hold that. So when you're looking close at stuff, you get a little dizzy. You reach for a door handle, whoa, and then you get dizzy because the sinus building up in the frontal sinuses, they inhibit your lack of holding that perception gaze. So you're reading and you get dizzy. Oh, I can't see it. I'm so close. But yeah, so if you're infected in the frontal sinuses, you're going to lose depth perception, which will make you dizzy. You could always, you can clear it and put lemon juice with a Q-tip into the nasal passages, and that'll clear that out. You can pump the sinuses, the soft part of your hand. As you breathe in, you push on the bregma, which is right between the eyes, and exhale and let off. You can pump your sinuses to clear out. But yeah, having the sinuses full and trying to converge for contacts and movements, you're going to get dizzy then. So you can have dizziness and imbalances from having sinuses full and a congested cold like that. That's one of the symptoms we all have. We're a little dizzy and we can't look close. And looking at like you're on a boat and you have like movement sickness, or what is it called? Boat sickness. And motion sickness is when you're in a car and you're reading close and everything's passing by and you get it. You get sick and nausea. Well, that's the lack of brain processing this movements on the outside. So the lack of, you're driving and it mimics like optokinetics. So it's I'm driving, and everything passing me, the cars, lights, trees, sun behind it, and it's flashing like that. My brain, as I'm looking straight ahead, has to process that. And if the thalamus can't filter down, which is called a vestibular ocular reflex, this passing by, my brain constantly has to suppress it. So if I'm in the back seat and I'm reading my phone nowadays or reading a book on a trip, I get really nauseous and dizzy. It's your brain not processing this. So we have tons of, if it's coming in and you're fatiguing from the left, it's the same as if you're spinning to the right. So we do exercises to enhance that part of the brain so you can perceive movement without getting dizzy. There's a bunch of pathways. Or when you're on a boat and you lose your feet because it's changing, your brain has to fire that in thalamus and process it better. But if it's not working, you're going to be imbalanced from the feet because your spatial awareness is eyes, ears, and feet. So if it doesn't know where that is, you're going to lose it and you're going to be motion sickness too. So you can get that from congestion in the frontal sinuses for the lack of depth perception, things passing in the peripheral, which your brain has to suppress, or your feet not being on steady ground. Your brain is firing fast, it's no problem. It doesn't matter. But if it starts to fatigue over time or be underused, you're going to see that crash. So when
We have another person. Are you good?
yes.
Mr. Rosemarie would like to know if progressive lenses add symptoms of vertigo, etc. Or does
Oh, I love the questions. That's good too. So you naturally your eyes are supposed to see close, and both eyes should see far. So when you're changing, like sometimes a maneuver in optometry is, well, we'll do both. We'll give one eye focus far, one eye focus close, and your brain will adjust. Well, not in a good way, not ever in a good way, always in a bad way. You don't want your brain to adjust to this. And both eyes should be here and both eyes should be over there. And that should work because that's how they're designed to move. And that's process and thalamus. So when they do one contact for far and one for near, your thalamus is crashing, fatiguing, and that creates a depth perception sensitivity. So you come in or you have to look close, and the optometrist is trying to tell you, oh, well, your brain will adjust, but it's never better. It's always worse. Actually, here I try to get them to recorrect. So if they have to see close, don't make one brain side far and one near. Put progressive or like reading glasses because both eyes are supposed to do the action close and far. Don't make your brain adjust. It's never good.
That's more like contacts or surgery, but what
Yeah.
about like minor progressive lenses? So they're supposed to just naturally adjust to both, correct? Would that cause vertigo?
No, but if you have a light sensitivity, it would. The thalamus isn't processing a good amount of light and it's fatiguing from it. You'll have a transition problem. So that will get into light sensitivities because you're supposed to process full light and not always be filtered from it. Our brain is wired up. Yeah,
I
go
know
on.
when I get new
It
glasses,
is?
my depth perception for a step is off, and I get like a headache for a few days, and then my brain or eyes adjust. Is that like what happened to the brain to adjust to it? Now I don't have those
Oh,
issues.
so for a stronger prescription,
Mhm.
yeah, the brain will adjust just because it's not used to how strong it is or how the receivers are. But really, all of the optometry is how short or how long the eyeballs are. That's really it. It gives you visual acuity. So your focal point when you see, if you're nearsighted, you have a very long eyeball. It's too long. It's changing the focal point to be this close. So when they adjusted, they put contacts or corrective glasses. They're changing the focal point. So that's what optometry really does. When it gets into they're watching your eyes move together, and then they blame it on astigmatism. Whereas it's like they explain it like an egg that's squished and it's not rolling well together. That's nothing to do with it. They have no idea. They didn't do an MRI of your eye and see what shape it is, if it's flat, concave. That's just they don't know brains, so optometry doesn't really know how eyes should congruently move. Called conjugate eye movement. So when you're moving together, both eyes are supposed to move like they're glued together. That requires the balance canals and good balanced brain function. And when there's fatigue, they're not going to move together well, one direction or the other. So we rehab that here to strengthen brain so that you have really quick movements of eyes, and we don't blame it on squished eyeball stuff. Because you can have, let's say you're a seizure kid born, you have these contraction seizures as a child, you can malform your eyeball, but that's a very less than 5% stuff. The rest of us just through life we have dominant side and brain and a non-dominant side that changes our balance canals, and that interrupts how our muscles move our eyes from the brain to the muscles. So it's a brain muscle thing.
So you did vertigo, you did this equilibrium, you did with dizziness, or is that just all attached? Like what happens
Yeah.
when I'm laying on the floor and I stand up fast and I get dizzy?
Ah, perfect. So then you could look at, so when it could be blood, it could be orthostatic hypotension. So maybe your heart can't take the transition. So it's the lowest point of beats per minute and blood pressure is when you're laying down, and then it requires your heart to pump when you give gravity. You're sitting next. That requires it to pump harder to deliver more blood and oxygen up. And then you go to standing, and that's the greatest amount of demand on the heart to pump the oxygen to your brain now. You're not laying, it's really easy. Sitting's middle, mediocre, and then standing's the best requirement on the heart to deliver that oxygen. So if you have things like orthostatic hypotension, that's a problem because your heart can't get that signal enough to fire up hard enough, and you'll immediately go from sitting to standing and not have the blood there. So they could get into cardiovascular reasons of why you're dizzy when you're suddenly transition. So that's more cardiovascular. Brain wise, as long as the canals are firing them. But yeah, there could be into cardio too. Okay.
So is there some kind of a protocol, perfect diet, perfect exercises, so your body's so balanced and you don't and you don't have all these like colds, dizziness, or any other symptoms. There's such a thing that you can
Yeah. Yeah, exactly.
perfect health or what?
Yeah, it's perfection is really hard to get to, so it's a phrase of like it's good enough is better. Because there's an ideal of the optimum health, but it's a balance between three things. It's the fuel, so the best nutrition, the best food, the nutraceutical, the best vitamins and mineral deficiencies, all these come in through fuel. So, like in the orthostatic hypotension, that's usually a mineral deficiency and it's not firing the heart like it should as well. We're looking at the other part of the triad, oxygen. So, oxygen to the brain allows for the balance canals and your muscle tone and all the switches in brain to fire at their maximum. So it's a fine balance in perceiving optimum health. But these are the three triads that we go down: fuel, oxygen, and the last one is activation. If I do neural activation or brain rehab, we speed up parts of the brain so they are faster to control organs or patches of skin or the heart or muscle tone. So this is the triad, and all of these should be measured.
So
But a
when
lot
we
of diseases come out of mineral deficiencies and or oxygen. Oxygen is the number one nutrient that we need constantly in life. And you have to turn on the control switch from the brain to wherever it's going to go. That has to be at a fast rate. You don't use it, you lose it, and you deactivate brain connections. You can't breathe in enough oxygen and deliver oxygen. That's a problem too. And if you don't have enough minerals or nutrition, all of those can give you disease. So on the prevention side, we don't look at lack of medication as being the problem. We look at these three things and making them the best you can as long as you can, so you don't get into hospitals and emergency life care stuff. This is prevention, and this is 99% of our lives. It's a balance between food and nutrition, oxygen, and activation.
But I think what you're asking is how is the best foods and
Yeah.
make it all work.
of course, so
Yeah.
Yeah.
we need the whole
Yeah.
protocol of combining all those three things and how can we help? Yeah.
Yeah, it's hard because if you were the expert or doctorate in each one of those things, you would have been in school for like 35 years. And no one's walking around telling, where do we all just do a piece of it? So like fuel, every diet out there actually works in some degree, but they all start with clean food. Right. So when you're looking at nutrition, reduce the processed stuff, the GMOs, and make it not toxic. Right. So like more maybe organic type foods and nothing processed. Artificial sweeteners, trans fatty acids, the bad seed oils, these are all processed. So every diet there is, whether it's an Atkins or a gluten-free diet, or that could be no meat, vegan, like whatever diet it is, you got to make sure it's clean first. If it's not clean, you're defeating the purpose. So that's a good basis when you're looking at fuel and nutrition. Is just stop doing processed stuff.
What about oxygen? Just like a breathing system gives you enough or proper
Yeah, usually not enough because it's a delivery system. So I mean, you want to start being able to breathe well, like the things like sleep apnea and fatty tongue and the drop palate and all these things blocking oxygen to come in. Maybe you're a mouth breather and you don't do anything through the nose. So you got to deliver oxygen the best. But as we age and degenerate, it's just how fast do we degenerate? At the end, true death is no oxygen in brain. That's what death is. Whether you're stabbed in an alley or you have diabetes or you just have a heart disease, whatever it is, your real death is no oxygen in your brain. We all die the same way. Different delivery systems, but the same thing. No oxygen, no brain. So you can do things like we have hyperbaric chambers that you breathe in 100% oxygen, not 21% like our normal ambient air is. And it's under pressure. So when you have oxygen under pressure coming into your body, it increases stem cells. And those stem cells make new vessels in the brain. And those new vessels make new tissue of brain. So it increases stem cell production and makes new vessels in brain tissue. So our dementias that have really degraded, degenerated vessels in their brain and they're forgetting everything and their personality and everything is just melting away. You start pumping up oxygen and making new vessels, they're going to make new brain tissue and come back from it. Hyperbaric oxygen chambers have been treating dementia for decades and doing really well. Oxygen's amazing. And when when one is in the chambers and they're under oxygen, under pressure, I go in and I know what part of brain is deficient or underused, and I run optokinetic tapes to fire up like some certain side of brain that I think is underused, or we do brain exercises while you're under oxygen. When a cell fires off, it requires oxygen because they just had a response. So it electrically fires, needs more oxygen to fire better, and we start lighting up areas in the brain and body.
Could you actually say that X amount of uh, hours in the hyperbaric chamber will change, will improve your brain?
Yeah, absolutely. They've had quite studies for 30, 40 years. I mean, we've known it to be for burn victims and skin stuff. It heals skin so much faster. We have patients who have plastic surgeries and they need to heal way faster than the months that it takes and way better and to reduce infections. So they come into the chambers and they heal their tissues with 40 to 50% oxygen, and under pressure, it dramatically changes. And we also have we have patients that have brain tumors that have swelling all around the tumor affecting their systems in brain. We put them in there and it reduces the inflammation greatly. So that little tiny tumor is now this big, full of inflammation in the brain, and it's wreaking havoc. So that oxygen delivering to the brain actually is very anti-inflammatory and it reduces the size. So
Is there reduce all kinds of inflammation?
yeah, globally. So yeah, globally, from arthritic hips and joints to inflammation in sinuses or even brain. That's incredible. That's the power of oxygen. Here I do activation and oxygen in the chamber combined. It's even a better result.
Because
Yeah.
for fuel, he also does food testing for sensitivity. So though there may be certain diets that everyone says, oh, let's do keto, oh, let's do paleo, oh, let's do eat junk food, whatever your diet is, like he can test. We have people that will bring a little bit of what their most common eating foods are, and then he'll test your muscles to see if you have a reaction. So it's just a sensitivity. So they can eliminate some things. Oftentimes we eat the same things all the time, and the same things that may
Habitually.
be good, though it may be clean, though it may be organic, it can still cause trouble in your system. And it could be seasonal, it could be period
Oh,
of
sure.
time, it can be, I mean, we've seen somebody that, loves eggs, but couldn't eat the egg white, but could eat the yolk. And then
Oh,
months
yeah.
later comes
Vice
back
versa.
and now she can't eat the yolk, but she can have the egg white, or she can have it fried or scrambled. It was like, if I was sensitive to egg, why is it in different forms? I'm not sensitive to it. So you have to learn your body to know what your diet should be and just make the best choices.
Yeah.
Is there a blood test that can actually tell you what you should be eating?
Yeah. Well, they'll tell you what you're sensitive to. Like I tested in person by putting food on the tongue and watching your body actually weaken out. And then you can take it off and you're back to like neurologically strong. But there's blood tests that will do the same. Yeah. You can take a bunch of vials of blood and they'll test it against apples. They'll test it against bananas and milk and they'll bring a report back telling you like all the things that you're reacted to. But see, everyone's sensitive to food. Not everyone has allergies or autoimmune sensitivity. So they're different sensitivities versus autoimmune reactions or allergies. So we test here in person for sensitivities, but there's blood works for sensitivities also. They take it in a lab and they test it against all these food types, and then they tell you which one your blood reacted to. And they could be good food. You could be very healthy and you can't process apples well, and you'll have digestive issues then. Bloating, gas, rib cage stuff, pain in the back, shuts down your hip flexors, and then You're eating an apple and now you have back pain and you don't know why you haven't gone to the bathroom for 3 days. Sensitivity. Here, we'd put an apple on your tongue and watch it weaken your entire body and then take it off your tongue and it's fine because there's a recurrent nerve for memory of food on the tongue. And that's related neurologic wise to the ileocecal valve, which is the valve that connects the small intestine to the large intestine. That's neurologically connected to your hip flexors or your iliopsoas. So there's all this inner embryonic connections between organs and muscles and sensitivities and digestion. But we go through sensitivities really fast. Instead of waiting 2 weeks to take 3 vials of blood and get the results back, if you've got a problem with Captain Crunch, you put Captain Crunch on your tongue and I'll see it immediately. They're about 80% accurate. What?
Dr. Brock eats correct.
I'm not sensitive to it though. That's my favorite.
The peanut butter one.
Yeah, the other one's no good.
Oh yeah, they're all really great for you.
But with sensitivities, just don't eat it. Once you identify, don't eat it for a couple of weeks and you can reintroduce it. But don't go like just clearing your diet and just eating food one by one as you introduce. Just whatever you're testing sensitive to, don't eat it for a couple of weeks and your body will reset itself. And it can be great. I've seen salt react, I've seen tortillas, like just the most bland milk. Today I tested milk was reactive, 1% milk, Cheez-Its, a little bit of chocolate. These are all, like the milk was a reactant for a lot of them. But yeah, those are just, you take it off your tongue and you go back to strong. You don't eat it for 2 weeks and you can start eating it again. Pepperoni too. It could be just random food.
Sounds like a teenager's diet.
Ah, maybe. Cannot identify them. But I wanted to go, so when you're imbalanced versus just vertigo, get the crystals up, knock them out, let them reabsorb. But the brain is like in cerebellum in the back. It's still, this is the back of the brain. So cerebellum, that little darker part, which is really, really tight folds, convolutions in it. If you were to fold it out flat, it'd be bigger than the rest of the brain. That is highly developed for body movements, eye movements, head positions, and coordination back there. But you could be too strong on one side and under firing on the other. So when you're looking at imbalance, I close my eyes and I get thrown left. Whoa. Well, this right one could be too fast and the left one could be not fast. And you want them the same. Because my right cerebellum pushes me to center. My left one's job is to push me to center. And if they're firing fast and equal, I can close my eyes and I won't fall over or move. I'll have great balance. I can balance on one leg and do Tai Chi and all that. But if they're imbalanced, then I do things on the balance board. Like, you want to come on up?
Really?
There's no way. We're getting closer.
To zoom out or zoom in or do whatever you got to do.
So I want to show what we do in the office. Yeah, no, it tests Smarty. What do you think? Yeah.
Okay, what am I doing?
So I'll get you by bringing it maybe this way. You won't get stabbed by the table. Is this still in line?
Not that.
What?
Okay,
Oh, perfect. So we can see this.
Can you see it? Or?
Mm-hmm. Do I have lasers on here? Oh, I didn't bring the laser. There it is. So this board moves like that. So a lot of PT clinics, which I love physical therapy, we're together in rehabilitation. But PT clinics don't have electronic boards most of the time. They have static ones, wooden ones that tilt so you can feel yourself. That's a slow rate of feedback to brain. It's not fast enough. If you can feel you're tilting, you just adjust. It's not that much of a stimulus. This moves on its own. It tilts and it kind of moves in an oblong shape. This requires way more brain to change than it does on some board that just barely moves. So I do a lot of rehab on these. And let's say cerebellum fires in from our spinal cord and our posture. So when you're on there, you want to make sure your head is straight. I can do that with the laser. So a laser, there we go. We're going to do surgery in this lower right quadrant.
No, you're not.
No, not today. Next time. But you can see it has the crosshairs. So when you put the crosshairs on, you line up at the target in front of you and make sure your head is straight. So when you're on the board, you're really firing your spinal reflexes to hold everything together. That's better feedback in brain, betters your balance. Go ahead and don that on your head. And they could, I always try to find a way to use the lasers. I just love them. And they could, is it? Oh, that'd be fun.
Yeah.
As long as the laser doesn't get her.
Look, it's super cool.
Oh, I don't think it's splitting anybody's eye there. But she's projecting a cross-haired laser. Might even hit the camera. But
Oh, yeah.
so now that tells your sense of balance or where your vestibular system is, where your head is.
I'm not even doing anything.
It's got to be the laser. And they could, yeah, not at the camera. Don't hit the camera.
You want me to hit the camera?
Oh, we'll face it maybe along the
There's too
window.
many things. Why is it way up there?
Because you,
I told my hold up.
I'll have an
My
angle.
glasses are too big.
I can
Oh.
adjust it. We're adjusting.
Looking super cool right now.
I like it. And it's live. Because you brought the head strap way down so that it would tilt.
I'm trying to make it not fall off my head.
Now, can you aim it towards the window? On the edge of the window. Yep, right there. So go ahead and step up.
Seriously.
I won't let you fall.
Even stand up.
So it's a little difficult already. Edge of the window. See that top left corner? Right there. Keep the crosshairs there. So I already know she has an imbalance in her cerebellum.
Yeah, I'm going it a lot.
She falls to the left, which means the right one's too fast. And the left one's not fast enough.
It's supposed to be standing straight.
I would just keep that edge right there. So when she's engaging her deep neck flexors and holding her spine back, firing into brain,
I can't stand straight and hit that corner.
because you have a balance canal weakness.
Really?
This is
My head
exactly-
is lower. I have to lower.
Well, tilt it down.
My glasses are too.
And they could, good. So what I'll do is we'll do a little test sample and then we'll add some stuff. So we'll
You
go,
can do this.
so we'll go on
here.
3. Pretty much we're the only ones that do this. But we'll go on 3. 1, 2, 3. So she's keeping her head stable, which means her spine is in the middle. Because if she looked up or had her head tilted, we would see it. And now while she's there, her brain has to process where her feet are. You're missing the ground. Requires cerebellum to fire better. But with her case, the right cerebellum, right side, is too fast and it pushes her left. Going to speed up her left side of her cerebellum. So you can go from touching your nose to looking here at me.
Oh,
Yep.
gosh. Really?
Yep. So this fires her left cerebellum more than her right.
I'm supposed to look at it? And how am I supposed to keep that straight?
Oh,
if
just
I'm
every
looking
once in a
over
while,
there?
look back, but eyes on the red. Gotcha. I'm going to give you a break. Good. So that lit up her left
Had the
cerebellum.
table earlier.
Yeah. Yeah, nothing.
To do with nothing.
Here we go. You can hold on to my back. No, just kidding. So that increases left cerebellum, but the right one's too fast. So let's slow that down. This is going to do a very rhythmic, cruciating left pinky move.
You better look.
She's in hip. Oh, that is better.
That's here.
There we go. When you're working with brain, it changes in real time. That's the coolest thing.
Being on that board.
And doing targeting to the left. That combination. And activating the spinal control. She went right, should be worse.
Yeah.
She goes left, it speeds up the left to match the right. We want to balance brain. Whatever's too low, you bring it up. If I went right on her, she was doing right activations, it would imbalance that more and she would be falling harder to the left.
And how long does those results last? Can you
What?
listen to keep the morning?
If you're really
Oh, yeah. Yeah, usually when we start treating on boards, the balance is improved for several days. We treat again. You're getting a week to
He'll
10
give you
minutes.
exercise to do
Yeah.
simulate the same
Yeah.
thing.
But don't wait
You
to come into
You
me.
can do targeting on your foot and doing all that stuff.
Yep.
And he teaches you what.
Yeah, there's stuff at home that I know you won't have a balance board or lasers on your head, but there's home versions. You can stand on a leg and target up to the left. So, but I want to slow down her right to meet her lower left. So trying the pinky, slowly moving there. Yep. So we're getting that.
Moving my pinky
Really slow.
while focusing on that.
That slows down cerebellum. There's a whole technical, it's the cortex of the cerebellum, the
I can't
outside.
move my pinky.
There you go. It is hard. So you're
And I'm
slowing
gonna
down.
move this forward.
Yep. Ready? 1,
So that focus.
2, and you don't have to have it so out. You can bring it to your side. Yep. And move the pinky and nothing else.
You know,
But have your hand out. Spread your fingers.
You don't.
Spread my fingers.
Yeah,
and move
like
the
this. I'm
pinky.
doing it right here.
I can't even do it.
It's hard. It's really hard. You want to go rhythmically, like so slow.
Okay.
Because we want left to be faster and precise. We want to slow down the right side. We're slowing down right and speeding up left. So that's a right
That's
inhibitory
right.
signal from cerebellum and the cortex. So
Slowly
Yeah.
move my pinky.
So we're going
while
3.
I look at an X on a wall and I move my body on a balance board.
And your head position's really good. So we're
Got it,
going
got
3. 1, 2, 3.
Oh my Jesus.
So that's pretty nice. No problem.
What
Whoop, whoop.
about? Look at that.
Kick in the deep neck flexors. Pull the chin. Yep. Now get that. And while you're over there, look at this target. There you go. And look at the red. Oh, okay. You're gonna get-
You're nuts.
There's good. At home, you would stand on one leg or the leg behind the
I
weaker
wanna do
side.
that though. That just
You want to do it.
added like 5 things.
Which one do you
I'm
wanna
a
do?
pro at this. Let's
All
do
of them?
this. Okay, yes.
And the targeting?
Yes,
Okay.
of course.
So 1, 2,
Challenge.
3.
Okay, moving the pinky. Back place.
And then stare at the red. Yep. Every once in a while, look back at the wall, but stare at the red. Good. And don't forget that pinky.
Oh my God.
Good. So now we're speeding up right or left and slowing down right.
Telling you folks. This could be you.
Wouldn't that be fun? Gotcha.
We're good.
But now check your head.
Oh.
No, I mean, there's all kinds of checks. You would close your eyes. You would stand with one leg, stand with the other leg. You could march in place, with your eyes closed. It tells a lot. But this is how we do imbalances, disequilibrium with or without vertigo. Because it's a separate thing and it needs to be balanced.
Are
You
we
did
done?
great. Yes.
I think we should give her a hand.
This is
Yeah. That was great.
Anna White. Right here.
The better version. Yeah, I mean, it's exciting. We have most of our brain controls muscle tone going down and sensory coming up. So it's afference up and motor down. And it has to be equal and balanced on both sides.
Another question. Ms. Resme would like to know what happens when you stand in one position, your body moves back and forth, and you lose balance.
body just stop.
Yeah.
Like
Oh, you will.
like a swing or something?
Yeah, we would call it drifts or sways. So in an exam, I look at you standing, and if you sway forward, Yeah.
When you have your eyes closed.
you can sway with your eyes open, but then that part of your brain is even that much weaker. So you could sway with your eyes open, and you're really not firing that back of the brain well. And that's a big issue. So we start slower than putting you with targets and lights and all this. If you do something at home, I would run, like let's say you sway forward. That's an anterior forward canal weakness. So I would run an optokinetic as you're watching them down. So I'd run it down, which fires your posterior canals. So if I was drifting forward, I would do an exercise where I'm watching these red and whites going up, which it fires my backwards canals. So then when I close my eyes, I'm in the middle. When I'm drifting forward, I excite the back, and it brings me back. So there's a lot of canal manipulation or activation that you can do. It's all creative. So you can do targeting, you can stand on one leg, you can do circle figure eights. These all fire into that coordination center. I think coordination is way more important than part of the brain for muscle tone, because it's our sense of where we are in space. That's a huge thing. Any other questions?
That's it. We are 7:05.
Oh,
More minutes.
good. Because I went
Is
over.
there anyone else up to out? Nobody?
No, but we can just achieve. We can achieve the idea of optimum health. And we can be very healthy. There's no perfect. There's one person on earth that ever did. And they could, and they could, and they could. So this,
What if medication gives you?
oh yeah. Yeah, there's lots of side effects like that. So medication with vertigo, you would, of course, ask the doctor who prescribed the thing that gives side effects of vertigo to reduce it or give you a different medication. And if it's something like, I'll go into a series of like statin drugs, an example of side effects that could be avoided not by taking more drugs, but actually coming off them. Statin drugs lower cholesterol. Lowering cholesterol changes your androgens, progesterone, testosterone, and estrogen. These are bad. Cholesterol is a precursor to your hormones. So if you're reducing constantly the thing that makes your hormones, you're hormone deficient, which causes all kinds of mess with the dysfunction of organs like breast cancers and prostate and uterus and all this stuff. So actually anti-cholesterol meds is not a good thing. And there hasn't been a study ever that related cholesterol and heart attacks.
Work?
They don't work. They make medicine so they make money because they make money giving you drugs. And they can't alter nature because they're never going to do a $20 million study on glucosamine or magnesium. Because why would they? They're into making money.
Twice, I think, when I had the twins. And all
Yeah.
they gave me was steroids.
Yeah. And there are like, vertigo or dizzy medications, but does it really work? Maybe temporary, but it doesn't fix the dysfunction in brain and why you actually have it. So they have like little band-aids of medications that help temporarily, but you should never be on medication. Unless it's the only thing you're way at the end and it's the only thing that saves your life. But and you're in the 95 prevention, medication doesn't fix anything. It just it's not made to fix anything or cure anything. They manage disease. So if they're in the AMA and they're prescribing, it's to manage disease, not cure disease, not fix or reverse, manages. So there are medications for vertigo, but they're just managing your vertigo. Why not fix it? And they could, and then remember, there's over 200 causes, right? So if you're dehydrated, you'll have issues. You could have a number of pathologies. Maybe there's a tumor. Maybe you have a thing like Meniere's that's the issue. Whatever it is, you go on the function side first. But in medicine, it's earaches to brain tumors. In the middle is where most of us operate, and that's just slower underused brain function. We sit too much. We don't move like we used to. And that creates fatigue in brain and under firing rates. No one ages and gets better in gymnastics. They always get worse. But you can slow the dysfunction. Yep. The right minerals in food, oxygen, and activation.
We do all
What,
three.
what
Here.
you say activation that is that included like exercises,
Oh, yeah.
like yoga and Pilates and all this stuff, or what?
Yeah. Yeah. The more you move the body, the better it maintains itself. Yeah. I mean, a lot of those are pretty good. There's always a blind side to each of the arts. Like yoga, they overstretch spinal cord muscles that are supposed to maintain and hold our spine together. That's a problem. But most of yoga is pretty good. There are some they turn off the wrong muscles sometimes, but they're just not aware of it. Yeah, there's always a blind side.
Is there an exercise system that you recommend over the other?
Oh, yeah. Absolutely. There it is. That includes everything. Thank you for reading the list that we asked you to.
Yeah, right.
But yeah, in NeuroGym, brain-based workouts is using and recruiting all of brain to conduct as fast as you can to muscles and joints so you don't injure yourself. But we start with interval training. So you're moving so fast for only 10 seconds. You could be on a bike and you're biking really fast. The rest of the minute, the other 50 seconds, you just coast, catching your breath. Because when you go really fast, what I call blur, if you're moving so fast that you're blurring your body, Like you could be rowing, run, walk, like all this. As long as you're moving 10 seconds as fast as you can, it dumps glutathione from your hypothalamus, which is the master antioxidant. It'll pick up all the free radical damage and degenerative causations. It raises testosterone. So if you have energy issues, blur for 10 seconds. So we start 5 times at 10 seconds of blurring, which is our interval training. You don't need weights. You just move fast. That's it.
As fast as you can move, whatever that is.
Yeah. You probably move faster than I can. So I'm going to do like fast jacks, or I'll just jump really fast for 10 seconds. It's exhausting. Those 10 seconds are the longest 10 seconds I've ever had. But then that just warms you up, dumps all the endocrine stuff and all the hormones in the brain. So you're ready for exercise.
Is it got it's how much interval only?
Yeah, it's a form. But interval training, that term is highly abused. So they'll do weight training really fast. Well, you shouldn't weight train fast. That's not intervals. They call it intervals, high intensity interval training, HIIT. Right, you go to one of the big gyms and they have like little rooms and they do HIIT, but they're weight training as fast as they can. You shouldn't weight train. You shouldn't hold weights. You can't blur. You can't go that fast. So it's not really true interval training. It's a faddish type exercise. Not good for a brain. You shouldn't move weights as fast as you can. You're going to damage your joints or rip something. It's a recipe for injury. So when you do blur, just move your own body as fast as you can. You can jog in place. You can jump fast, but it's only 10 seconds. That's enough to dump testosterone in the endocrine system and glutathione to protect your cells in 5 minutes.
Is it 10 seconds or is it just whatever you can resist doing it as fast as you can?
Yeah, we start beginning program. We do 10 seconds, only 5 times. But as you progress, yeah, you could do 20 seconds and then 30. 30 is really hard when you're moving as fast as you possibly can. And you can do like between 5 and 10 interval minutes.
You're saying 10 seconds 5 times.
So it's 10 and then rest
like
for
5
50
minutes.
seconds.
Is the rest of the 50 seconds of the minute, you're just doing the activity slow.
Yeah.
So if I was doing the row machine, I would go as fast as I can on the row machine for 10 seconds, and then I would just row for the other
okay.
50. It's
Yeah.
5 minutes.
You're catching your breath. You can stretch. I just require that they move a little bit.
Yeah.
And you're ready. You're watching the clock. And that minute hits again, boom, you just go like fire. And you're super fast. But that will dump hormones and change your brain chemistry faster than running for a mile.
Mm.
You won't even reach it running a mile because it's a very steady, slow pace. Treadmills in the back at the gym, they're not doing much. They're there for hours and they're not getting results. The spinal cord muscle activation, so just turning on muscles, like when Crystal was up and she's retracting the neck, you're turning on muscles that protect your spinal cord. These are good because these fire before your larger kinetic movement muscles. So if I'm doing a program where I'm shrugging my shoulders, I'm always going to squeeze my blades down and together. Let's say it's a bench press. You're laying on a bench press and I want to do chest. It's chest day. And I'm pushing forward. Well, I want to turn on the muscles of my spinal cord up there better. So I'm going to squeeze my blades down, which I call tucking in the wings. And then I'm going to push forward. I'm not going to let go of this. I'm going to lock it in. So when I'm doing a press, I can do press, I can do shoulders. I'm going to keep my blades right here because these fire before my shoulder does. And if they don't fire before my shoulder gets damaged or I'll get tight and get headaches. So you can squeeze in your blades. I'll keep in there. And you can push up, you can pull down, you can push forward, you can lift to the side. And you don't have to let it go. They're separate. So if you fire your spinal cord muscles, like scapular stabilizers, pulling in your stomach to protect your lumbar, keeping your neck back, these protect you while you go through exercises. So you don't, well, what I used to do is I blew a pec, a shoulder, and a hamstring. That's what got me into neurology. So I had to figure out why I was ripping all this stuff.
So we are out of time.
Oh.
You are welcome to come work out here with us at 420 Monday through Thursday. We will open up other sessions and group training in the future as we see growth. But right now we have a class at 420 Monday through Thursday. You can also do one-on-one training, and he can teach you what you need specifically to work at your house where you don't have to do it here. So he will design a whole program for you and your body to do at home. So that
Yeah.
is an option as well.
We've made a program for people on vacation in hotel rooms. No weights or anything. And if they want to do
6 weeks, and she said, I don't want to not do my workouts. So
Yep.
can you do something that I can do anywhere? And he did. He created a 6-week program for her to be in Europe
Yeah.
and do her workouts. So yeah, the 3 things, the triad we do in-house. You're welcome to come and hang out with us. He really likes his board.
That's so cool.
So
And it prints. It's a photocopier. I can print off on paper anything up there. Sorry.
our next coffee with Doc
Yeah, what's
Kevin is when?
and they could
Second week, first week.
And they
First
could-
week of the month. So it's the first and third. The first week is at 9 a.m. The third week is at 6 p.m.
Yeah.
So
Is it stroke or is it shoulder?
I don't remember. I just send everybody the text. I don't really.
Yeah, because we planned out a few going into the future, but we went through. Yeah.
Strokes is on the 2nd, and shoulder pain is on the 16th. And then we'll update the form and send out for the next 3 months. But we hope you
Yeah.
learned something.
Yeah, thanks for being here and
Come out
Zoom
with
and in
us.
person. But in person, you get coffee. So you missed out on Zoom.
Once to the neuro gym, you can right there write a program.
I would say
Yeah,
4
that's more
times.
one-on-one.
One-on-one 4
Yeah.
times. Not to the 4 o'clock class. 4 o'clock, you're learning just bite-sized portion. But if you want him to make a protocol for you, I would say over a course of a month, once a week, one-on-one, he can do what you need so that you can do it.
Yeah, we'll go on vacation and do it without weights. I mean, there's like Charles Atlas kind of things, basic body movements against gravity. But yeah, it's small group training, so it's $75 a month, and we do it 16 or 20 times a month, depending on how many weeks.
One-on-one is one.
Yeah.
But for that, it is.
But it's custom, and because the other in the basic program I wrote up years ago, and there's basic, intermediate, advanced, super advanced, and super duper advanced. We got to get a better name now. Super duper? That's a pretty advanced one.
Super duper? Okay.
Yeah.
Bye, friends.
Oh,
Thank you.
well, thank you. I'm Doc Brock Neurochiro. I won't crack you up, but I'll get on your nerves. Yes.